of birth?
My birthday is July 13th.
July 13th, what year?
I'm 47 years old.
Ma'am, is there what are you doing there? What's the matter?
Oh, I'm in awful pain. This hurts. Am I gonna die?
What
hurts?
I don't know. I have back pain. My kidneys hurt. I'm just falling to pieces.
Well, try to calm down for us so
Can
we
you sit
can
down
talk
here
to
for
you
a
and
minute?
Sure,
see what's going on.
Sure.
Okay, so just about one thing at a time. Let's try to stay focused on the things at hand. Let's
How long is this gonna take?
we'll just take a minute, but we're here to help you. So let's go one thing at a time. What's bothering you right now?
The pain all over my belly.
Okay, like is it a certain area of your belly?
Mostly up mostly on top of under my ribs. Yeah.
Can you use a finger and point to where it's hurting?
It's like all right in here. Oh, I can't stand it.
Is
Give
it
me
on both
something.
sides? Go ahead. Go ahead and sit down for us. We need to.
I mean,
We need to
look,
check-
you give me a drink. A drink will help this. Here, look, go to the store. Nobody has to know. If you can just, please, just buy me one. I mean, I have these.
I can't do
I
it.
have
ma'am.
these. I just,
Well,
no one has to know.
let us check you out. We can get vital signs and check you out and make sure everything's good.
Oh,
and
it's
then
not
we
gonna
might be
help.
able to-
It's not gonna help.
But we gotta go. We gotta take
Now,
one step at a time.
now you're
Okay?
not smoking these here, are you?
They let me have these. These are what they let me have.
Okay, well, let's leave these here because there's no smoking in the hospital, okay?
Okay.
Now, can you have a seat? First, we need to assess you, and then we're gonna check and see what you have ordered, and then we'll take it from there. Is that okay? Okay. Can you tell us what your pain is between 1 and 10 right now?
It's a 10 out of 10.
10 out of 10. Okay. Can you describe your pain?
Oh, it's all over my belly, but mostly on top, under my ribs and my back.
So is it on
All
both
over.
sides?
Yes,
Okay.
all over. Am I gonna die?
I don't think you're gonna die.
Why does pancreatitis have to hurt so bad?
I'm not sure.
Have you had this pain before?
Yes.
Okay. And how long have you had it?
Well, for quite a while, sometime now. I drink a lot at home. I mean, well, just about a beer, maybe a beer a day. Maybe a few on the weekend. But it helps. Please, just go. Get me some, please.
Well, we can't have beer in the hospital unless the doctor orders it, but I don't think that's going to happen. So you had some medication earlier, yesterday that helped? Did the medication you got yesterday help?
No, nothing helps. Nothing.
Okay.
I mean, I never wanted the poison I was given. They too much trouble for me. They were trying to track my blood.
Well, because we're trying to figure out what's going on with your belly.
No, I don't want you to track my blood. You can track me all over the place.
We can what?
You can track me, my blood. If you take my blood, you track me. You know where I'm at.
Well, the reason they take your blood is try to find out what's going on with you.
When was my son here? His stuff. Did you take my son? They took my son. Look, they're watching me. I've got to get away from this.
Let's sit down, okay, ma'am? Let's sit down for a minute. Let's sit down.
Look, I've got to get away from these cameras. They're watching me. They
They're
took
not
my son.
watching you. There's nobody here watching you. We're just here to help you. Go ahead and sit down for me,
My
okay?
son, he's 12. He's getting so old now.
He'll be okay. Let's go ahead and sit down.
Yeah, Jane, can you
You're
tell me why
trying to tell me that he's okay?
your son is with your sister.
My sister, you left her with her? Where is my sister? Where is she? Where's she at? Do they have her too?
She's at her home.
She's at her home with her for. I'm sorry.
She's at her
Why is
home.
this funny? Why is this funny? I'm being serious.
Ma'am.
I'm gonna look at your chart.
Your sister has your son at home with her children. We're gonna take care of you. We just need to assess you, vital signs and everything. We'll get you taken care of. We have to do other stuff before we can give you, just go ahead and straight give you medication. We gotta try to help you out. So just sit down and relax for us and we'll.
Okay, I'm listening. Ask me your questions. I've got to move around just a little bit. I feel like, I'm just losing it. I'm just.
Does that seem to help you?
There's some alcohol in this.
And she's got morphine.
Oh, there's nothing in here. Oh, here's some more.
You sick?
No, here. Hang on, let's take away the sharp object. Can you sit down
I'm so
for us?
worried. My son, maybe he would be better off if I was dead.
Is this all that's gotten you worked over? You worried about your son or the other son?
Is that what you want to do? What do you want to do?
I'm in pain. I just
Well,
want to
she's
drink.
in pain,
What
so
else? Let me
I'm
have
gonna
anything.
get her something for pain.
Okay.
And she is having her DTs and tremors, so we're gonna give her something to
I'm
do
not
that.
crazy. They're right there.
Okay.
Well, I mean, they always have cameras in hospitals. They're not
But I
watching
guess
just
we're gonna
you.
get her violence.
So they're watching everybody, but
You can do
they're
that.
trying to quarantine us.
Okay.
Like, we'll
If
never
you
see
want to go
our
ahead,
families
you
again.
can
They're
just
gonna
tell me
take us
that
away
you
and
can
kill us all.
pretend you've got the
They do that
lorazepam
for your well-being.
and
Take care of
morphine to give her.
Okay, first I'm gonna
I
probably
think-
give her
I-
just the
sorry, I
morphine
need
because
to
that's all
stop
she's
the
running.
phone on
You
please.
can't smoke inside. This is a non-smoking facility. But if you'll sit down, the other nurse has gone to get some help, and we're gonna get you taken care of. Yeah, 136/82.
Okay.
82 on pulse, 20 respirations, 98.6 on temp, 99 on room air.
Okay, Miss Jane, I have some morphine for you that's gonna help with your pain.
No, I don't want to be sedated. I've been through withdrawal before, and this just isn't it.
Well, that's not for your withdrawal, that's for your pain in your
My
belly.
pain is gonna help. Nothing else has helped. A beer would help.
Well, we can't give beer right now, hon. But the morphine may help with your pain, and if it doesn't, then we can call the doctor.
I mean, my thoughts, they're just racing. I just have 1,000 different thoughts in my head right now. What are you trying to say to me? What are you trying to, oh man, I gotta get out of this place. I mean, look, what is all this stuff?
Ma'am, let's sit down and we can give you this morphine. If you'll sit down and relax and just try to just try to relax and maybe lean back, and we can give you this medicine through your IV and just give it a few minutes.
Maybe I should just calm
Let's
down.
go ahead and put your legs up on the bed.
I can't be calm. I'm too worried about my son. I mean, I've got
But look, this
I
will
mean, I
this'll
didn't
work.
dog one
Look,
time,
let's-
and
back for me.
I don't know. I need to go to
This'll
school. I
work.
gotta leave my
Look,
kids in
just-
school. I mean, my husband's at home. I just,
Ma'am, it'll be okay. Look, let's lay back, okay?
Let's try this.
You can put your feet up here and let's
We'll
just
try this
relax.
pain medicine first,
okay, let's try it. Oh, it's just not working. I've got to get out of this place. I'm gonna die here. Don't you understand me? I'm going to die.
What makes you think you're gonna die in the hospital?
Well, you aren't giving me anything I need. You're not helping with my pain. I told you just a drink. One drink would help me. Let me go smoke. Let me have a
We can't
drink.
give you any alcohol, but she's got medicine that will help
It's
you.
not helping. I don't think you're giving me
haven't given-
anything.
we
You're keeping
haven't
me here.
given you
You've taken my
anything,
son.
ma'am.
You've taken my sister. You've taken her family. Y'all are watching me. Y'all are gonna.
I'm here with you, man, but we haven't given you anything. We gotta have you calm down.
Those people, they're watching you too. They'll take your family before you realize.
Okay. Well, if you can calm down for us,
How
and we
about
can.
that I stay here with her and you can call the doctor and let her know that she's heard new symptoms she's having?
Someone please help me. Please.
Has the morphine helped any with your pain?
Oh, actually, I think my pain's a little less intense now. It's probably about a 3 out of 10.
Okay. And then just call the doctor and see about her other new symptoms that she's having.
Why is pain so awful? Why does pancreatitis have to hurt so much? Oh man, these people next door, they're just
Come on,
Ring,
let's
ring,
go back to your room
This is
for a
Dr.
minute,
Winstead.
okay?
This is
He's-
Clay. I'm
right
here
now,
talking about your patient,
He's gonna call
Janet
the doctor.
Owen.
You think you
Oh,
can, don't you?
the
You can go
other
to-
nurse
No,
that
no,
Who's she?
No, I don't think.
She's a
No, I
47-year-old
don't think
female
that's
that came in on Monday with a history of pancreatitis, and a history of alcoholism. We went to her room today. She was complaining of abdominal pain.
Okay, yeah, I know
Sit
she
down
is.
because I
Okay.
want
She
you
gave
to-
an
I
order
want
to
you
give her
be
morphine.
safe, and I
She
want
initially
you-
stated it was a 10 out of 10. After the morphine, it was down to 3 out of 10.
Yeah.
But now she's
Your bed, your bed's
having some
fine.
delusions and thinking that people are watching her, going to take away her children.
Okay.
Huh, okay.
Talk to me.
Is she suicidal, homicidal?
Oh man. Okay.
She doesn't. She's not.
Oh, there's light.
I might have to call you back on that way.
Okay.
But we'll go reassess that situation. But
Okay.
she doesn't appear to be suicidal or homicidal. Her main concern is her child,
Okay.
thinking that somebody took her child away from
Okay,
her.
let's go ahead and get a site consult, and we can get some, if she gets aggressive, we can get some Geodon, 10 milligrams.
I'm just holding my breath all day.
So,
You're gonna kill yourself?
so we need to get a site consult and then Geodon 10 milligrams. Is that correct?
That
She
is
gets
correct,
aggressive?
I am.
I am.
Yes.
All right.
All right, thank you.
Thank you.
Sir, are you finally back to help me? Are you gonna help me?
Can I help you, ma'am?
You want me to step out?
It's good. Dusty, what? Okay, y'all are good.
Oh, sir,